What's going on, y'all? Welcome back to another episode of the Struggle to Strength podcast, your source for real-life application on how to turn your struggles into strengths in all things mind, muscle, and money. I am your host, Josh Levine, and I am joined here by my longtime friend and my co-host, Travis Hatch. And today we have Toby Pasman, a neurophysiology researcher and founder of an applied neuroscience company called Roscoe's Wetsuit, I believe, using Neurotech to massively improve people's mental health and help them reach optimal cognitive performance. If you know us on this podcast, we're all about optimal. We're all about maximizing brain function.
Big brain.
But y'all, big brains. What is it? Not smooth brains. We got grooved brains up in here. But y'all, we talked about everything from neurostimulation to overcome neurodegenerative disorders. And we even got a little bit deep into one of my favorite topics, psychedelics and mental health. So stay tuned. Before we get into it, we ask that if you love this episode, please give us 5 stars on Apple or a follow on Spotify. Share us on your socials. You can find me at Josh Levine Fitness and Travis at Travis Hawks Media. That's it. Buckle up for a great conversation that had us on the edge of our seats the entire time as we bring you Toby Pasman. My girlfriend was asking a little bit about what you did, and I was like, man, it sounds like I'm a fitness trainer, and obviously I optimize health and fitness from the body. And so we're training the body and then we're assessing the improvements. And I was like, I think he basically does this for brains.
That is a pretty apt description. Yeah, no, I like that a lot. I use that same comparison seriously when I tell people what I do.
It's cool, man.
Yeah, seriously. Because it's like in the same way, it's like, I feel like, right now it's like normal for people to go to the gym and take care of their bodies. It's like, 5-10 years from now, I feel like this is like the next frontier of health and wellness, where we're going to see just, these brain training centers and labs popping up, because I
love that comparison.
It's coming.
Yeah. It's fascinating because obviously we see a need to keep our brains healthy. Obviously, like, we're a very externally focused society right now, where people tend to just look at the outside. People want to lose weight. They want to get fit. They want to look good. And, my issue with this is kind of the sustainability component is not really the focus anymore. And I think maybe that's because there's less money in like curing these things, like actually teaching people how to do it. So I'm curious to know, like, what got you interested in this? Was it just a general interest in brain health, or was it personally, like, my grandfather died from Alzheimer's and dementia, and so I know that runs in my family. So, like, I want to take care of my brain. So I'm curious, what got you into this?
Mm-hmm. Yeah, there's a couple of different ways I could answer that. I guess, starting off, like, as a kid, I was always a very curious kid. I was thinking about my own thinking about, why other people are doing what they're doing. Just, I was always just kind of curious, and that curiosity led into reading some pop psychology and neuroscience books in high school. But it wasn't really until I was in college, and, I started off as a business major, didn't really know what I wanted to do. I realized I was not going to be able to spend the next 4 years doing those hour and 50-minute lectures. They were just too dry. So I started taking some different classes, and it was a biopsychology class that, like, really blew my mind. It was like learning about the biological basis of how the brain operates on a chemical and electrical level. And that led me to work at an EEG lab. For those people listening who don't know what EEG is, basically an electroencephalogram, a tool that can be used to monitor a person's brain waves, the electrical rhythms of their brain. So I started doing that. I was just like, this is absolutely fascinating. But I was more so thinking, like, at that point I got to see, all right, we're assessing all of these people's brains in real time with this technology, but that's all we were doing, is just assessing. So I'm thinking, like, at this point, well, is there a way to modify and actually improve the activity of the EEG? And that curiosity then led to the couple jobs I got outside of college, working at both the Peak Performance Center outside of Seattle, training a lot of like Hollywood actor type people, business CEOs, some athletes, worked doing that, and then worked at a substance abuse and mental health treatment facility in South Florida. So got to see these neurotechnologies kind of being applied in, very different settings, but noticed, people just reporting such great improvements. And also I did notice, for kind of why it was personally relevant to me, I struggled a lot with social anxiety growing up, and it was really detrimental to my quality of life, my ability to form friendships and relationships. And as I started playing around with some of these technologies, I actually found that stimulating a specific part of my brain was actually super helpful in terms of really speeding up kind of my verbal fluency, which was something that was kind of impeding my ability to conversate with people, because I'd always be searching for the right word and losing what I was going to say. So it was like a big component of my social anxiety. And I realized with some of this neurotechnology that it was kind of due to a specific area of my brain working a bit too slowly. So actually doing some of the neurostimulation sessions, I would actually notice, like, from the beginning to the end of the session, I'd be on the phone with someone, and, at first, I'm like thinking what to say, and, the conversation might not be going too smoothly. And by the end of the session, I'm like playing a game on my phone or something and just not even thinking about speaking. It just was like, it blew my mind. So I was like, there's something to this. Other people are reporting great benefits. I'm like, I gotta do
That's
this.
awesome.
Like,
and as you're speaking, I'm like, yeah, I feel like I need that.
Me too.
And I imagine
we could all
it
use
sounds,
it.
I've listened to quite a bit of Jim Kwik, and it sounds like, and obviously correct me if I'm wrong, but it sounds like he and his strategies, I'm sure you're familiar with Jim Kwik. So it sounds like his strategies are more exercise based, of like teaching people how to remember things and to do like brain games to get better at remembering things and things like that. But this strategy seems strictly stimulation, like a session where you go in. It sounds way easier, to be honest, and you come out reaping semi-similar results.
Yeah. So, I mean, that's a good way to think of it, I guess. So it's definitely, what I do is definitely a biological approach, in the sense that, we're going to assess, what symptoms or what areas of a person's cognition they want to improve. And then we're going to look at their electrical data. So we do a brain map, which is basically that EEG recording. That raw data is then the computer transforms it into these 2D brain maps, where you can see areas of overactivity, underactivity, and healthy activity in each of the different brain waves, going from the slowest delta to theta to alpha to beta. And we're able to see which areas of the brain that under or overactivity is occurring in. So it gives us all this data to basically assess a person's neurophysiology. And then from that, I basically tailor a neuromodulation protocol, usually involving, I really like neurostimulation because it really seems to pack the most punch. And as you were saying, it's completely passive. It's like you literally, I put electrodes on someone's head, push a button on the computer, and it's going. You could be watching a movie, reading a book. You don't have to actively be doing anything. Your brain is just getting entrained to produce, the rhythm that we're stimulating. So that's kind of the approach, is when we kind of get the biology of the brain working better, which can really be done through regulating the electrical brain waves. Everything is going to be way easier. So if say someone then is going to one of the Jim Kwik trainings, or is, doing one of his courses or something, they're going to likely find it easier to use these different memory tricks, because their brain is working, their memory centers are working better on a biological level. It's just
that
going
makes
to make
a lot of
things easier.
sense. It's so interesting as you're continuing to talk about things that people like to improve upon. I'm like checking things off in my head of things that like I do or my dad does. and things that I've wanted to actively improve upon, because I know it will improve my life and my ability to connect with people. And your note in mentioning that by the end of one of your sessions, you'd be like on your phone playing a game and still engaged in conversation. I can't do that. like, I am so lazy. Like, I have severe ADHD, but if I'm focused on something, I won't hear people talking to me. So if I'm on my phone, like, the people closest to me know, like, he's not going to hear anything you say. And it's something that I know my dad does, and we've always called it selective hearing. But like, I want to improve upon that. And you're telling me there's a way.
Yeah, likely. I mean, we would see what's going on just on an electrical level, and yeah, by making some changes and putting you either on neurofeedback or neurostimulation, you very likely would see a change.
In the fitness world, and like, this is how my brain works. So I'm trying to like really understand this. There are also, like, I hate to use these terms, but like underactive and overactive muscles, which I'm sure maybe in your world you don't like to say certain things, but they click with people. So that's what I'm going to call them: underactive and overactive muscles. And me, for right now, as an example, my lower traps are a little bit underactive. They're like another quote unquote turned off. And that's kind of messing with my ability to move properly. So we can stimulate it with electrical stimulation while I'm training, and that can actually help improve the muscle's ability to fire. So this sounds like the same thing. And how long has this been around? Because it makes sense.
Yeah. So the origins, I would say, would go back to probably like, in terms of neurostimulation, a lot of people, when I'm describing neurostimulation or introducing them to it, their first thought is like electroconvulsive therapy, shock therapy from the 1950s, which is actually still used in rare cases today because it's been found to be really effective, even for people who've tried and failed all the antidepressants. So that, I would honestly say, is sort of the origins of like stimulating the brain. It's a very crude method where it's, using a huge dosage of electricity. So just to compare what that is versus the technology I use, that is somewhere upwards of like 700 to 800 milliamps of electricity, whereas the technology I use is somewhere between like usually 1 to 2.5. So massive difference. And they've basically found that you can still achieve a lot of the same benefits with this very low intensity neurostimulation, but just without all of the side effects, the slew of side effects, memory loss, personality changes that can occur with, say, electroconvulsive therapy. So I would say that's how I usually describe it to people, is like, I feel like that was sort of the beginnings of being able to stimulate the brain. And then as the decades have progressed, they've just fine-tuned the technology to, get it to a point where we now know the best levels to reap all of the benefits without having all the negative side effects.
That was my question, is like, is this dangerous?
Yeah, no, it's a great question. And it's actually very, very safe. There was a 2019 meta-analysis. So basically a study of a bunch of studies conducted with transcranial stimulation, the form of neurostimulation I use. And they found it very safe, very, very, very few adverse events. The only real precautions we need to take is if someone has any history of epilepsy, seizure history, or cardiac heart issues, just because those, kind of involve electrical abnormalities. Still could be safe, but we just don't want to mess around with, neurostimulation in those specific cases. But for almost everyone else, the side effects, if you come into a session and are dehydrated, probably in the same way that if you were to go to the gym on little sleep and dehydrated, you might, kind of feel a little bit crummy afterwards. You could walk out with a headache. You usually advise people to, come into a session really hydrated and then drink a lot after the session, eat some protein, because the stimulation kind of, I guess, another parallel to exercise where, neurostimulation is depleting the brain of a neurotransmitter called glutamate. and glutamate's formed from glutamic acid, which you get from protein. So I actually tell people in the same way, like you might have a whey protein shake after the gym, you want to consume some good protein after a neurostimulation session. So if you're staying hydrated, you have protein after the session, people rarely experience any side
the brain
effects.
loves protein and also carbohydrates. And so yeah, we have to take care of it. Now when you're explaining a lot of this stuff, it's cool to hear the parallels between what we used to do, like electroshock therapy, and now we're fine tuning it. I almost think of that as like an intense chiropractic adjustment versus like a very gentle manipulation, and a little bit more
Right.
probably a little bit safer and a little bit more precise. But where I'm going is, what I'm curious to know is, we've learned a lot about the brain in the recent history. How much do we really know about it? Because only 50, 60 years ago, we were using electric shock therapy, and now we're doing this, and it went from a very abrasive technique to now a very gentle and very precise technique. How much do we know about their brain? And is this like outer space or the ocean?
Yeah. I mean, I guess time will tell, because I feel like it's such an exciting time in neuroscience where it's like the place, where I was working at, and I was, working under one of the top guys in the field, who's been utilizing neurostimulation, neurofeedback for like 20 to 25 years. And, he would be setting up new protocols based on like new research studies. Say a research study came out the week prior using a specific form of neurostimulation, say alternating current stimulation, and they showed improvements in depressive symptoms if you set up the electrodes at specific locations, what's called a montage, basically where you're placing the electrodes on the head. So it'd be like the treatments are getting modified and improved, as the research studies continue to come in. And I think we're just like, practitioners now who utilize this technology do the best they can with the research that's available. But I think if someone was to listen to this podcast, in 20 years, I think it's going to be like, wow, they knew absolutely nothing about neuroscience in 2021, because it's just progressing so rapidly. And there is still, like, I feel like, if you were to have an issue with your kidney, right, and you go to a nephrologist, like we probably understand just about everything there is to know about a kidney, right? Like, it's whereas the brain is like the most complicated thing in the universe. There's so much, you guys are absolutely right. There's so much we still don't understand, but that's part of, I think, what makes it so exciting to me is just, who's to say what we end up discovering with consciousness and tons of other unanswered questions in neuroscience.
I like Josh's analogy. Do you feel like our understanding of the brain is like the ocean or space? Because I think like the ocean is still like so much of it is undiscovered.
We know nothing about the ocean.
Right. Yeah. Like we don't know that much about the ocean, but like at least we know what water is. We know what like fish are, and you know what I mean? Like it's still, we understand like we understand the general idea, but we just haven't explored all of it. And there's a ton we don't know about it. Whereas space, I feel like we get up to a certain point and then we're just like, I have no idea. You know what I mean? Like what's dark matter? I don't know. Like there's no real, like we don't really understand space. You know what I mean? Like we understand what we can observe. Do you feel like the brain is more like the ocean or like space?
That's a tricky one, because in some ways it's like the ocean, in some ways it's like space. Like there are certain cells in the brain called astrocytes, which they literally thought these were just like useless cells. Like they thought, neurons are the main type of brain cell that they knew was, were responsible for all these different functions. But they used to think up until pretty recently that astrocytes were just like these useless cells that were just kind of there. Now we've figured out that there are in charge of like doing all of this cellular cleanup and have all of these super important functions, and we probably wouldn't be surviving without these sort of cells. So it's like in some ways, areas of neuroscience, we continued making like new discoveries where it's just like we knew what some things were, or what different areas of the brain did, but now it's like we're understanding it in way more depth than previously that we knew. So I would say, we have a good idea of which areas of the brain are responsible for which sort of functions, but it's a bit unclear, sometimes when there's like a specific issue, what specific area of the brain that might be tied to, that still might be a little unclear, just because there's so many areas of the brain that are all communicating with each other, and that produces our ability to pay attention and memorize stuff and focus. Like, it's not just one specific cell in a specific area of the brain. It's the communication and the speed of communication. So it's really like there's no end to the complexity of neuroscience. So I feel like in some ways it's like the space.
The brain is kind of the final frontier.
Yeah.
I've always been confused why that is. You know what I mean? Like, why do we know everything about a kidney, but we are so like we're still like so early in understanding the brain? Like I don't know.
It's just the complexity, the number of cells, the number of synaptic connections. The brain, neuroscientists regularly say it's the most complicated thing in the entire universe. It's, like we know, if someone was to lose, say a kidney or a specific part of the kidney, what might happen. Whereas there's been, brain surgeries done where people, have specific lesions removed from the brain, or they get hit in the head and it results in all sorts of weird symptoms, or sometimes there are other areas of the brain that are able to compensate. And despite someone having, say, a damaged, frontal lobe, it's like other areas of the brain are able to then take on some of those functions. So it's such a complicated organ, and it doesn't function the same way with each person. Like, I feel like the three of us, it's like if a doctor was to examine our kidneys, I'm assuming we're all in pretty good health, and they'd probably find that our kidneys are, the filtration or whatever they're doing, is probably just about the same. Whereas if I was to do a brain map on, the three of us, our neurophysiology would be very distinctly unique, So even though we're all, humans, we all have brains and we're all able to communicate with each other, it's like what's going on under the surface is just so drastically different.
We had a guest on recently who had some disparaging things to say about about like psychiatry and a lot of the like psychiatric medications mainly. He wasn't really talking about like therapy, but was talking about like medications for psychological problems. And I feel like this is probably what he was talking about, is that like, a specific medicine that alters your brain chemistry is given without looking what's going on under the hood. And like every single brain is different, I don't know anything about, any of this stuff, but I know that like, if, any sort of like brain altering substance, like I've seen it at every party, like it interacts with everybody differently, like marijuana, like a little bit might make me feel really chill, and the exact same amount and dosage and everything gives Josh a panic.
Exactly.
You know what I mean?
That's a great, that illustrates it perfectly. Yeah.
So is this kind of tool maybe something that is used or could be used for like mental health in general?
Yeah. I mean, these technologies traditionally have been more so in psychiatrist's office, in neurologist's office, so that is the traditional use of this technology. And I've used it, say, at the substance abuse and mental health treatment facility I was working at in South Florida. treating lots of, addictions, often comorbidities with different psychiatric disorders, PTSD, major depression, bipolar, even schizophrenia that we would treat with neurofeedback and neurostimulation. So, it's something that there's, I think, great benefits that people can get, even, just in terms of often being able to reduce their, the dosage of their psychiatric meds, if not being able to, get off of some of them entirely. We never advise people to do so without talking to their doctors, but oftentimes people would start doing neurostimulation, like say at this clinic that I was working at, and they would be taking trazodone or one of these kind of sleeping aids every single night. Just they were laying in bed, couldn't fall asleep, and then they start doing neurostimulation, and they can actually fall asleep, and they're waking up feeling refreshed in the morning instead of hungover from the sleeping pill that they took the night before. So it's like they're feeling better off the medication from the neurostimulation, and they just kind of gravitate towards doing more of this and needing less medication. So I think absolutely there's any psychiatric disorder that we talk about, there's going to be dysregulation in the electrical activity of that person's brain. So if we're able to assess what that dysregulation is and then work on improving and stabilizing the electrical activity, it's usually going to result in a lot of symptom improvements.
That's great to hear, because personally, as a major mental health advocate, and I struggle myself, I hate taking medication. Like, I don't like the way it makes me feel. I don't like the person it turns me into. I'm a zombie when I'm on Xanax. Like, it's terrible. I don't like it at all. And so I like to find alternative routes where I can still be myself and not suffer from the symptoms. Something I'm curious about is, obviously we have major benefits to mental health that we can experience through this type of neurostimulation. In mentioning my grandfather earlier, knowing that dementia and Alzheimer's does run in my family, brain health is important to us. Do we also see improvements in overall brain health and longevity? And if so, what does that mean for us as humans when our brains start to live longer and longer?
That is a great question, and one that I would say, is being studied by a lot of researchers, as far as we know that with any intervention, whether it's neurostimulation, whether it's an Alzheimer's drug, they're going to work better preventatively, rather than if you intervene once someone's already pretty far into the progression of Alzheimer's disease. There's little we can do, even with some of these newer technologies, as far as like actually reversing a neurodegenerative condition like that once it's already gotten pretty severe. But we do know there's all these contributing factors to, say, something like Alzheimer's disease. There's a UCLA neurologist, Dale Bredesen. I don't know if you guys have read. He wrote that I believe it was the End of Alzheimer's. That was his book. He wrote it a few years back, basically talking about all of the different basically things that are linked to Alzheimer's, such as high blood sugar, elevated glucose levels. So much so to the point that some researchers are actually starting to call Alzheimer's type 3 diabetes, because there's such a good correlation between these chronically elevated blood glucose levels, over consuming carbohydrates in the standard American diet, and people ending up with Alzheimer's. So there's all these other factors too, but I think that, if people eat, kind of a brain healthy diet, they sleep enough, they're exercising, maybe they add in, some of this newer neurotechnology, it definitely is going to set someone up for better brain health in the long term. As far as specifically, I can't give you any sort of specific numbers as far as how many years that could delay what different disorder, but we know that the basically the early symptoms of Alzheimer's start occurring decades before someone actually has a full-blown the full-blown kind of diagnosis of the disease. So it's the things that we're doing in our 20s and 30s and 40s, whether if we're not sleeping, or we end up with a lot of concussions, from playing sports or whatever other stuff is going on, it can absolutely increase our likelihood of getting a neurodegenerative condition. If we stay in great shape and take really good care of our brains, we can definitely ward that off. So as far as what a society might look like, with people not suffering from Alzheimer's, I mean, think about like, other cultures where it's like, they I feel like they have a lot more respect for their elders than we do, right? We throw our elders and grandparents in nursing homes, whereas like other cultures, I feel like it's like, they're able to like be the wise old people that are able to guide the younger generations. So maybe it would look something like that. I don't know. I mean, if we had a bunch of 80, 90, 100-year-olds walking around with the brains of a 25-year-old, like, I think that would change a lot.
It would be fascinating. We'd end up having to find new hosts for the brains.
Yeah, they need to take care of their bodies really well.
Yeah, or we go to the simulation theory and we just find a new host.
Yeah, plug me in. Plug me in somewhere else, please.
Yeah, plug me in.
You mentioned sleep a few times, which is something that I'm like super fascinated with. And after doing like more research and applying different methods of like getting better sleep, have had major like mental and emotional benefits recently. And it just kind of like reapplied like my understanding of why it's important. Like a couple things that have really helped me recently is like I've stopped drinking caffeine after noon, which for the first like 4 or 5 days was like really hard. And then just like, I don't even notice it anymore. And my sleep has been like, I wake up so much more rested in the morning. So I've just noticed like way less anxiety or like panic attack feelings at all. Like it just seems like sleep is like a natural anti-anxiety. I'm just wondering, like from your standpoint, like, do you study sleep a lot? Is it like something that you're like focused on, or is it just kind of like something that's mixed in there? Or what do you think?
Yeah, I've never specifically worked on any research project involving sleep, but I certainly read a lot about sleep science, and I've had a couple of sleep scientists on my podcast who've shared some really interesting things about sleep. And I absolutely believe, I think it's an anti-anxiety, antidepressant, I think, in general, it's the time our brains are very active while we're sleeping, contrary to what a lot of people are, thinking that it's just the time, the brain kind of goes offline during sleep.
Yeah.
Like that's a myth. The brain's actually very active. A lot of these cleanup cellular repair processes are going on. And that's what enables us to hopefully wake up in the morning, jumping out of bed, ready to start our day, and if we're not feeling that way and we wake up feeling groggy and exhausted, it's like, you got to look at what you've been doing. If you've been drinking alcohol close to bedtime, or you're talking about caffeine, or just eating too many carbs. Too many carbs is one thing. Like I started noticing, like if I eat like a, whole pizza or something, like a couple hours, prior to sleep, I'll wake up in the morning feeling exhausted. It's like all those carbs, I feel like, definitely inhibits my ability to get, that deep restorative sleep. But I think sleep's foundational. So I think whatever ways that we can find to improve sleep, other things that I think can really help people are like magnesium supplements. A lot of people are deficient in magnesium. I've actually started playing around lately with topical magnesium. I had a guest on my show who was talking about, she was using this topical magnesium lotion for sleep, for insomnia, panic attacks, anxiety, and you just kind of rub it on your chest and forehead, and you can notice very quickly just how your whole kind of body and nervous system really relax. So that's one I really like for sleep. And then, definitely like one thing I've noticed personally is just when I started using like blackout curtains in my apartment. Oh my God. I wake up in the morning just like, wow, I feel like I just got the best night of sleep of my life. Like just from that, just our eyes, not having any exposure to light can be really, really beneficial too.
When that light hits you, it triggers a cortisol response. And so if you can black out your shades, or what I do is I crack them just a little bit so the sun shines in the morning and I can wake up naturally and have like a natural circadian rhythm, then it makes a big difference. And your note on carbohydrates is interesting. So if we have like a lot of carbohydrates at night, especially if they're more high glycemic, very fast digesting, big insulin spike, insulin and cortisol will have that inverse relationship. I'm curious. So I've actually seen some good improvement by giving people a little bit of slow digesting carbohydrate before bed for a low insulin spike, but just enough for insulin to kind of blunt cortisol so melatonin can rise. And so I don't know if you have any feedback on that, or if it's something that we can attribute to what's happening inside the brain. But I was really fascinated by that because I know so many times I've heard people, don't eat carbs after 8 p.m. or like whatever it is. And so it was interesting to see that we actually got kind of a benefit, but it was really only pertaining to sleep.
Right. I remember I haven't done this in a little while, but I was playing around with using honey before sleep for a period of time. I'd been reading a lot about people. So I don't know if that's an example of one of those, I guess, slower digesting carbohydrates, but I definitely noticed some improvements in my sleep quality just from, a teaspoon or two of honey, raw honey right before sleep. So I think, our brain cells absolutely, use glucose as a primary fuel source. So if people do tend to be, more kind of have periods of hypoglycemia or low blood sugar, then maybe, I think it probably varies from person to person. And some people, with all this, but especially with sleep, it's like, someone might do great, eating a little snack before bed. Maybe that allows them to sleep through the night. Maybe someone who, doesn't eat for 3 hours before bed, maybe they wake up at 3 a.m. starving, and it's like their body waking them up saying like, give me, I'm running out of resources. Like, give me some more fuel. So I think there's so much individual variability.
It's really interesting. And like you said, that's how all of this works. Like every question that anybody will ask about them in their instance, it's going to be, well, it depends. And so I think while specific questions can have specific answers and general questions will most likely have like an it depends type answer, we've been talking about ways that we can improve our cognition and brain function through neurostimulation. We've been talking about ways we can improve those items through improved sleep. Are there any things that people can do out home outside of those modalities to help improve their lives, their brain performance, and just like their cognition in general?
I would say diet is definitely the first place to start, in terms of, I'm a big fan of like, a ketogenic type of diet, diet high in really good fats. Eliminating sugar is definitely a huge one that I think like that's oftentimes my number one recommendation to people who want to get the most out of their brains is just minimize, if not eliminate sugar. And you will notice just how much better, how much clearer you think, the periods of brain fog start disappearing. So replacing a lot of the, kind of those higher glycemic carbs and sugars with, good quality fat sources like coconut oil, avocados, olive oil, MCTs, butter, all of these good, healthy fats that, have been for a long time really demonized as, fat being supposedly, is what makes us fat. And there's been this huge, like, kind of low fat, high carb craze. And I think that's finally sort of coming to an end, as science has shown just the benefits of all of these good fats and how they actually are essential for, our neurotransmitters, the production of our neurotransmitters. The myelin sheaths that surround and insulate neurons are composed. These are fatty structures that are composed, of fat. Our brain is actually 60% fat. So it's like, if we're not getting those good fats, into our system, we're not giving the brain those sort of raw precursor ingredients that it needs to really perform optimally. So that's definitely a great place to start. And then I'd say, weaving in some like high intensity interval training is an awesome way to really stimulate the brain in a short period of time. So say doing sprints is one thing that's been shown to significantly elevate levels of a key growth factor called BDNF, brain-derived neurotrophic factor. And that's been shown, one neuroscientist described it as like miracle grow for the brain, in terms of it kind of just creates all of these new connections and new neurons sprouting up. And they found that just doing a few short sprints, just at maximum capacity, really triggers this BDNF release. Same deal with, high intensity interval training, Tabatas, or just some other high intensity interval workout where you're really pushing your body to the limit, in the same way that often results in like the biggest like muscle adaptations. When you're really pushing yourself to the limit, it's similar, the stronger the stimulus, usually the greater the response for the brain as well.
Thank you.
So really like diet. Yeah, no, seriously, if you're gonna like go to the gym for 15 minutes and like work out till you can't move anymore, or you're gonna like go for 2 hours and do like four sets of 12 reps for everything. Like, I think any day you're correct me if I'm wrong. Obviously, I don't know nearly as much of the exercise science, but like, I don't know. It just seems like that usually is going to produce way better muscle adaptations, just doing
the key here
periods.
And maybe this is the same when it comes to improving brain performance and cognition. The key is that harder isn't better. So like, you can go to the gym and you can work out for 2 hours. You can run yourself into the ground until you're throwing up and you crawl out. You can barely drive home because you can't push the clutch in. Like, that doesn't make it better than if you were going to have a 30-minute workout where you trained with a very high level of intensity, extreme focus, perfect execution, and you can recover better from that workout as well. So there's a lot that goes into it. And I imagine that the brain is the same way. From what we've been talking about, there's a lot of similarities. So like, and this almost sounds like with the electroshock simulation, same thing. More isn't better. It's just the right amount. We have to figure out what the right amount is.
Yeah. Well, and even the length, the duration of neurostim sessions, there's a sweet spot that we know, usually doing it between like say 20 to 40 minutes is going to produce the greatest benefits. If we were to put someone on neurostimulation for, an hour and a half, 2 hours, there's not going to be any like real, like terrible long-term side effects, but you're going to be exhausted. You might be like drooling on yourself by the end of that. You're going to need to go home and sleep for 12 hours. Seriously, because it's like in the same way that you can over fatigue a muscle. It's like too much neurostimulation, is not a good thing. And same thing, if you were to only do a minute of it, you're not going to get the benefits. So it's like that sweet spot of, like 20 to 40 minutes at this specific intensity, a couple times a week is like going to work the best to produce, the brain adaptations that we want to see.
I'm sure like that's different that's individualized depending on how well people can recover from that, right? Yeah. Okay.
To some degree. Yeah. I would say for sure. And sometimes I would see some patients or clients who are able to do neurostimulation sessions every day and they feel great doing sessions every day. And then there's other people who do better, taking a few days off per week, say doing every other day because they're getting kind of over fatigued.
That's cool.
No, that's a great point.
I was going to say, I also, on the Huberman Lab podcast, which I've talked about. I love that podcast. I don't know if you're familiar with it, but he had like a neuroscientist on, and they were talking about the same thing. Basically, there's a connection between pushing a workout to pushing sets to failure and like cognitive enhancement. Basically, what you were saying before, like you put like pushing a workout to failure with proper recovery is going to be, help like for muscle growth, but it also stimulates like brain cognitive enhancement as well, which I think is like pretty interesting.
Yeah. There's so many parallels, honestly, between the physical fitness world and the mental fitness world. Like, another thing that like improves your, kind of capacity to work out longer, being creatine, is a supplement that obviously is huge in the bodybuilding community. But now like neuroscience has shown that creatine actually, like in the same way, it might, enable us to say do 11 reps instead of, maxing out at 10, maybe we're able to do that 11th rep. It works similarly with the brain that we're seeing people are able to sustain attention and focus for longer periods of time. So it continues to just show like just all of these parallels between what works in exercise and what works with stimulating the brain. It's crazy how similar they are.
Now that we're talking about supplementation, this is something that I really wanted to ask you about, and I think Travis even put it in the notes. I'm a big proponent of psychedelics, especially psilocybin mushrooms. All right, we love it. So, right, like new neural pathways, able to stimulate the brain function in a lot of different ways, able to overcome mental health battles in a lot of different ways. How do you feel like psychedelics tend to impact the brain when used properly, like when used safely and effectively, not when they're taken advantage of and abused, obviously?
Yes. No, it's a incredibly interesting area of research that, I had a guy from Johns Hopkins, the Psychedelic Center. I believe it's called the Johns Hopkins Center for Psychedelic and Consciousness Research, that was founded a couple years ago. It's the first center in the United States that exclusively studies psychedelics and how they impact the brain and mental health. And I had this guy on who's a psychiatrist at Johns Hopkins at the center, and it was fascinating to learn about this and hearing about the studies done with psilocybin, with MDMA they're using for treating PTSD in veterans and autism, like social anxiety in autism for autistic adults. There's ketamine treatments that we're now seeing as being another, like that's another game changer. We're seeing like these ketamine infusion centers pop up, that ketamine is shown to be like a super rapid antidepressant, that these traditional antidepressants take 6 weeks, up to 6 weeks to work, if they're even going to work, and a lot of people they don't. But with ketamine, it's like people are experiencing really rapid, great improvements in their depression. So there's so many different substances and of these psychedelics that I think are so powerful as tools. And I think in the coming years, what is really going to be ideal is having like therapists be able to do like psychedelic assisted therapy, because I think ideally you have licensed professionals who understand the brain, understand mental health, and understand what these psychedelics are doing, and then be able to like help people facilitate these shifts in perspective and mindset and consciousness that are occurring while under the influence of psychedelics, but actually having like in Eastern cultures, they have shamans, right? Or like they're guiding you through the experience. Like it's gonna be a lot different than just taking acid and going to Disneyland. Like you're gonna have a much different effect if you have a. Well, you have to, could be still fun.
The thing is, you have to learn how to use them. And if you have someone who can teach you how to use them, it's much like learning how to exercise. You could fuck yourself up and do it the wrong way a lot of times in a row, or you can just hire a coach and they'll help you do it the right way the first time. After having used psychedelics for quite a while myself, now I'm at the point where I'm very open about this, especially with my therapist. Like, I am able to have such more productivity, like a massive amount of productivity in my sessions with my therapist, because we'll dig into something and I'm like, I've seen this and I've worked through it myself, and here's where I've gotten on my own. And then she will take me the rest of the way and ask me the right questions that I was not able to find on my own. But man, once they open up psychedelic treatment centers, like, sign me up. I'm surprised I haven't done like a ayahuasca trip with a shaman yet, because the amount of power that I believe they hold is, I don't think that we quite understand it yet. And it's interesting to me because they've been shunned and pushed aside for so long in place of these other newer things that people are making a lot more money on, which again is part of my problem with the healthcare industry. And now finally they're coming back around. We're starting to realize that, okay, like maybe we do have something here. Maybe this is helpful, and people are seeing real change, and it's very promising.
And the therapists recognize it too. I mean, I've heard therapists quoted in certain papers saying like that they're able to facilitate changes, in one MDMA assisted psychotherapy session that would be equivalent to what they'd be able to see with like working with a patient for like 3 to 5 years, like in one session, like being able to have these, like, so it's like, I feel like now that the like professionals are starting to see how powerful these treatments can be, and how what's been prescribed in psychiatry for all of these decades. I mean, it's really it just doesn't cut it. The medications that are available, the big pharma, there's so many side effects, and then you're on a medication to treat the side effects of this other medication, and then you got a third medication treating the side effects of the second. It's just like, it's a mess. And I think psychedelics can, if properly used, like facilitate just like really positive, large changes in the brain that they've seen as like sustained. Like a single dose of mushrooms, a large dose of mushrooms was shown in one study that I saw, that if people had the same improvements in their depression 1 year later that they had like right after taking it. It like, that's crazy. If you were to take an antidepressant, if you were to take Prozac, for a year, and then you stopped it a year later, it's not going to have done anything. If anything, you're going to be in worse shape from the down regulation of some of those serotonin receptors. But psychedelics seem to be able to like facilitate these really positive long-term changes in the brain and in mental health. So it's an incredibly exciting field.
Be a testament to that. I am a fundamentally different person for the better because of my experimentation with psychedelics combined with therapy. In fact, in just a couple sessions ago, my therapy, we had a breakthrough. I went to Burning Man, did some mushrooms in the desert, found myself like super eye-opening experience.
There you go.
Came back, we talked through it, and it was super emotional. Like, I cried so fucking much. But she was like, Josh, some people don't get here, like, ever. Like, a lot of people don't ever get here. And I was like, who knew? All I had to do was go into the desert and eat some mushrooms at Burning Man with a bunch of weirdos. But man, I think it's powerful. And I think that especially when we're talking about brain health, mental health comes into play. I think psychedelics and other drugs are very powerful. And obviously what you're doing, for those who are maybe not a little bit averse to jumping into psychedelics and using drugs that have been given to us in order to help with these things, what you're doing is just, it's incredible, man. It's really cool. You're making real change in the world. You're studying really fascinating things, and it's been really exciting to be able to pick your brain. So I gotta thank you, man. This has been like,
of course,
I'm so fascinated by this stuff.
Yeah. And one last point, just related to like with the work that I'm doing, I see such a synergy with psychedelics, like in terms of a lot of these psychedelics are also stimulating neurogenesis, stimulating the growth of new brain cells, new connections. So doing kind of having the same mechanisms that neurostimulation works. So figuring out, like, I think that's going to be the real trick once these things start to become legal, figuring out how to like best stack these things. Like, say maybe doing a microdose like 2 hours before a neurostimulation session. Like, what if that, I haven't done the research, but like, what if we're able to see that, a person's brain it becomes, way more flexible and plastic, and able to be changed, which I would assume it would be, since, it's really, that's what the substance is doing. Like, I think that these two worlds of like neurotherapy, neuromodulation that I'm in, and psychedelics, I think it's gonna be a perfect couple.
Yeah. It's going to be really cool. And I've always had a theory, especially with psilocybin specifically, in its ability to help generate new neural pathways. I always had this theory. Like, if you take two people and you try to teach them something new, whether it's a golf swing, an Olympic lift, whatever it is, and they're the same, like if you could split a person, they will learn faster with the addition of psilocybin. And I'm very confident in that because of its ability to generate new neural pathways. Now we're talking about doing this in a way that is going to improve your life in much more than just a movement pattern. And we have the ability to do that with what you're doing. And I cannot wait to see it combined with psychedelics in hopefully the very near future, because Travis and I are from Colorado, and it's already decriminalized in Colorado. I think we're well on our way, but it's really exciting stuff. And I'm really excited to see where your field goes in conjunction with it, because it's going to lead to massive change, and it's really fucking exciting. Yeah.
Indeed. I would echo that same statement. Yes.
I could honestly go on forever about psychedelics, but we are just about an hour, and man, I am absolutely going to want to follow you. I've already checked out your website and read a lot about you. I know our listeners are going to want to as well. Can you give yourself the plug? Like, what do you got going on? Where can we find you? Where can we learn more about what you do, and where can we get treatment?
Yes, great question. So if people want to connect, they can DM me at Roscoe's Wetsuit Neuro. That's the Instagram account. We got a YouTube channel for my podcast and company, Roscoe's Wetsuit Neuro. There's daily clips, podcast clips, and full episodes that are being posted on there. And then the website, people can check out www.roscoeswetsuitneuro.com. And they can learn all about the different neuro technologies that I use. And if they are in the Miami, Fort Lauderdale area, I will be offering these services, doing brain mapping, neurostimulation, neurofeedback, a couple other technologies that we haven't actually talked about, but doing those in person with people in the South Florida area beginning in just about a month. I'm going to be making the move and setting up shop there. So if people are in that area, they can hit me up, and I'd be happy to work with them. If they're not, but interested in, exploring this neuromodulation world, I would say, if you Google your city and neurofeedback, you might be able to find a psychologist, usually psychologists, psychiatrists, sometimes employ that sort of technology. Neurostimulation can be a bit tougher to find, but if you go to a specific website, neurofield.org, there's a provider directory that shows you can plug in your zip code and then find providers in that area that utilize that technology. And yeah, I would say that this stuff is might be new to some people listening, and some people may have heard of it but never used it. But I think just as in the next 5 to 10 years, we're going to just start seeing the explosion, really in like the peak performance and wellness fields, that, this application of the technology where I'm taking the technology with my company, as we kind of began the podcast with, I truly feel like brain health and, taking care of your mental health with this technology is really the next frontier. So I think people are gonna be seeing a lot more of this stuff wherever they live.
That's amazing, man. I thank you for everything you're doing. I will give you a follow and keep in touch with you. Again, thank you for your patience, and thank you to everybody who tuned in to another episode of the Struggle to Strength podcast. We're getting kicked off here. There's somebody playing music, so we're going to take off. But thank you again, Toby, man. This was absolutely amazing. We'll stay in touch. Everybody else, we will see you next week.